In continuation of the previous video, here we can see the food designed for the white stones in dogs is the calcolitic food, and the goal of it is to decrease the urinary pH, to decrease the intake of calcologenic minerals which are low in magnesium and phosphorus so that the stones can form, to reduce the urinary concentration, and in dogs to decrease the protein so that the urea concentration is decreased, which is a substrate for bacterial urease, and to increase the sodium so that there is the increased water intake and it causes diuresis. It is the basic principle which is followed in all types of the stones treatment. And in the dogs, to decrease the urinary pH, we fed with the DL-methionine at the rate of 100 mg per kg body weight 2 times a day. And the duration of dissolution process goes for 3 to 4 months. And meanwhile that the imaging of the urinary tract with radiography and ultrasound is performed. And we continue the protocols of dissolution near about 1 month after the confirmation of absence of stones. The next most common stones found in the dogs and cats is the calcium oxalate stones, which is near about struvite stones, that is 40 to 50% of cases of urolates are of the calcium oxalate. It is more common in male as compared to female, and the ratio of the cases is 2:1. It is present mainly in the lower urinary tract, that is in the bladder and urethra. It is radiopaque in nature, it means it appears white on the radiography. If we see the pathophysiology of the calcium oxalate stones, it is either due to hypercalciuria, that is the decrease in intestinal absorption of the calcium, or decrease in bone resorption, that is the primary hyperparathyroidism, or decrease the renal reabsorption, that is the hyperadenocorticism. The another reason is the deficient in the substances that inhibit the stone formation, that is the pyrophosphates which are derived from the phosphates. If the diet is low in the phosphates, as in case of struvite stone cases, if you fed the low phosphorus, so the pyrophosphates is low and it causes the calcium oxalates crystals. And if there is excessive restriction in the magnesium diet, same as in case of struvite, the chances of calcium oxalate stone formation is increased, because if the magnesium is present in sufficient amount, it binds with the oxalate and forms the magnesium oxalates, so that the oxalate is not available for the calcium. Then the another substance is the nephrocalcin, which is naturally present in the urine. If its activity is decreased, the struvite formation, the stone formation of calcium oxalates occur. Here we can see the how look the calcium oxalate crystal looks is like that macroscopically, and in microscopically here we can see that it's typical the envelope shape. The images has been shared with the video, go through that. Here we can see that the solubility of the calcium oxalate crystals are not affected by the urinary pH, but however if the acidic pH is there, it may contribute to the formation of calciuresis and the calcium oxalate crystals. For the treatment of the calcium oxalate, we can see that it cannot be dissolved. Only the method we can use is the ablation, that is the removal by the several techniques. Now, to avoid the relapse or the recurrences, follow the diets which are rich in phosphorus, potassium and magnesium. There should be decreased carbohydrate, and use the wet food or add the water to the dry fruits. Maintain the urinary specific gravity in cats and dogs as shown here, and do the regular urine analysis. And to ensure the adequate dilution of the urine, we use the diuretic thiazide, which inhibits the sodium reabsorption in distal tubule, and in turn it increases the calcium renal reabsorption, so that calciuresis condition doesn't occur and stone formation is inhibited. Don't use the furosemide and other loop diuretics because it causes calciuresis.